It's Dr. Imran Iqbal. He's from Baptist Health Hardin, and he's going to be talking about depression and dementia. And got it?
Yep.
So you all just listen away, and if you have any questions, do
Absolutely.
ask.
So let me turn on my microphone. Can you all hear me a little bit better now? Very good. Welcome. Good morning, everyone. How are you? I'm Imran Iqbal. I'm a psychiatrist at Baptist Health Hardin. I have until around 10:45 to talk to you about dementia, its signs, diagnosis, and its prevention. I speak about depression a little bit, but I wanted to focus more on dementia today and the general aspects of dementia. But we do touch on a little bit on depression because it is one of the symptoms of dementia. If you have any questions, ask. Just raise your hand. I'll try to. I don't have my glasses on right now because I can't keep them on while I'm looking at this. And then if I don't have them on, I can't see all that well. So wave vigorously, yell, whatever it takes. I mean, it's pretty informal here. So, and ask any question you want. You know, it doesn't have to be, you don't have to softball it. You know, ask me the hard questions. I may not know the answer. If I don't, I can always find the answer, take your name, and get back to you if there's anything that I don't know. So, but hopefully I'll know the answer. So let's begin. Very quickly, we will talk about what dementia is, its signs and symptoms, and there are general signs as well as more specific signs, and the specifics kind of come with the particular disease process that led to the dementia in the first place. Dementia is kind of a destiny that multiple disease processes take a journey toward. So dementia isn't really one diagnosis or one disease. It's really a constellation of symptoms that many diseases lead to over the course of time. So it's a little unique in that sense. But we'll talk about diagnosis and prevention, treatment very briefly. I'll show you all my references and of course questions at the end, but also throughout. And again, I have until 10:45, so I'll probably go pretty slow, but I might start rushing toward the end to make sure I get through everything. So first we'll talk about what dementia is. And it's kind of like I said, it's a general term for a group of brain disorders that can cause memory problems and make it hard to think clearly. So it's not just memory, but it's hard to think. It represents a significant decline in this ability to think or cognitive function. It's so bad that it actually gets in the way of functioning at home, functioning at work. You can't do what you used to do, and it's a significant amount of can't do what you used to do. So much so that you, a lot of times, just have to stop doing it. Now, it's like I said before, it's more of an acquired syndrome. There's multiple possible causes. It's not a specific disease. It's a set of symptoms that many diseases can lead to. And of course, I think that'll become clearer as I continue to talk over the course of the lecture or presentation or whatever you want to call it. What are the risk factors? Well, obviously advancing age. Genetics also plays a role. When it comes to diagnosing dementia, genetic testing can be done, although it's done rarely. There are single gene anomalies. Genes are what are make up chromosomes, you know about genetics, and you get your genes from your family. There are single gene abnormalities that lead to dementia. Vascular disease is also another risk factor. By vascular disease, I'm referring to the vessels that go to your brain. Your brain is like a sponge, and it's fed by the blood vessels. And if those get blocked, the sponge dries out. It can't work as well as it used to. What is dementia? There are several types, and actually there are reversible types of dementia. What that means is you can have low B12 or low folate, a B12 deficiency or folate deficiency. You can have low thyroid hormone, and that can lead to the signs and symptoms of dementia. But what's interesting about those causes is if you treat those causes, those symptoms of dementia reverse. So it's a reversible cause. But then, of course, there are non-reversible causes of dementia, like Alzheimer's disease, which is the most common form of dementia. The interesting thing about dementia is because there are many paths that lead to the same place, multiple paths can sometimes be involved with a given patient. So one patient may have a genetic etiology, a genetic cause, but that same patient may also have vascular disease, which has also contributed to the dementia that they're diagnosed with. A lot of times we see mixed dementia, multiple causes leading to the dementia. It's about 7% of individuals over 65 years of age, and that's globally. In this country, it's a little bit higher, about 8 to 10%. We're a developed country because we are developed, better nutrition, better health care, we live longer. Dementia can present a little more, it's a little more likely to present in a developed country because there are many more years for it to present because we live longer lives. Now, what are the signs and symptoms of dementia? There are general symptoms, and they apply to all the types of dementia, but there are also specific symptoms that apply to each one. So what I was going to do is, because there are a lot of symptoms to talk about, I wanted to talk about the general symptoms and then the specific symptoms according to which path led to the dementia in the first place. And again, I think that'll become clear as I continue to speak about this. So what are some of the general symptoms? Well, you think about problems with memory, you think about problems with thinking, so obviously forgetfulness. Now, the interesting thing about forgetfulness, if you're forgetting things, you're going to forget that you forgot. Right? But that does make sense. It's a little interesting, but it does make sense. You're going to forget that you forgot, so you don't remember that you forgot. So you're not going to complain about it if it's you, right? So who is the one who complains about it? Exactly. Family, friends, loved ones, they're the ones who say it. And, you know, I've seen it happen. The patient will be sitting there with, you know, smiling, everything's fine, I feel fine, and then the family member will speak up, well, no, you're forgetting a lot of things, and they won't realize because they forgot that they were forgetting. That's kind of the interesting thing about forgetting. You will forget that you forgot. So if you are thinking right now, oh, I'm forgetting stuff, because I know you're probably thinking that, right? I'm thinking it. Well, chances are it may not be what you think it is, because when it's really bad, that's when you forget that you even forgot. So confusion. You can see how that could be a symptom. Disorientation, forgetting the year, forgetting the date, the day of the week. The date's not an easy one, right? Because we all forget the date. But, you know, if you forget the year, that might be something to think about. Problems with speech and writing. You can't write like you used to. Maybe the coordination is lacking. Maybe you can't come up with the right words while you're writing a sentence or writing something down. Speech. We'll be talking about symptoms with regard to speech. You just have trouble coming up with that word. But it's not for something exotic or unique or something that you don't usually deal with. You're forgetting words for like pencil or pen or paper, familiar things. Glasses. Memory loss, we kind of talked about that. Difficulty speaking, we kind of talked about finding the right word, but maybe just saying something, that's a sign. Understanding. Someone says something to you, simple sentence, and yet your family or your loved one, they don't register it. An easy sentence, not a hard type of sentence, just a familiar, everyday type sentence. repeating questions, along with confusion. Over and over again, your family or your loved one will repeat these questions over and over again as if they forgot, but it's a little more than just forgetting. They're also just repeating questions over and over again. Wandering and getting lost in a familiar neighborhood. Again, familiarity here is the key. This is a neighborhood that your family member, for example, has navigated for decades, and all of a sudden they're getting lost in that neighborhood. Trouble concentrating and reasoning, we've kind of talked about that. But reasoning, very good logical thinker, a math major, the family member is very good at these sorts of things, and all of a sudden they're having trouble reasoning logically. Signs of dementia can show up in daily tasks, where previously it was easy to balance a checkbook and do math. Suddenly it becomes an ordeal. And it becomes an ordeal not only in the sense that maybe it takes a long time to do it, much longer than before. It used to take 15 minutes, now it takes 2 hours. But sometimes you can't do it at all. Using unusual words to refer to familiar objects. You can't say the word pencil, use a word that you kind of made up for it. Taking more time to complete normal daily tasks. Again, as things get harder to do, as it gets harder to think, it takes a longer time to do the things that you used to do. Bathing used to take 15, 20 minutes. Now it's taking an hour, even 2 hours. Now this is where depression comes in. Losing interest in normal daily activities or events. Depression is characterized by 2 core symptoms. Depressed mood, which is different from sadness, because all of us get sad. This is a more pervasive type of depressed mood. This is something that's all throughout the day, not the sadness that can come, for 30 minutes or after hearing some bad news or just having a bad day. This is pervasive, lasting weeks, months, years. But depressed mood is one of the core symptoms of major depressive disorder. Losing interest in things is another symptom of major depression. And it's also a symptom of dementia. You lose interest in things. Things aren't pleasurable like they used to be. The things you used to enjoy, you don't enjoy them, you don't do them. You liked to knit or to watch football. All of a sudden, there's no interest in turning on the TV. There's no interest in picking up the knitting needles. Acting impulsively. Your impulse control degenerates sometimes in dementia, meaning where previously you could control yourself from eating or drinking, suddenly that control is lost. Not caring about others' feelings. Where previously you were considerate and polite, the patient is suddenly changed and doesn't care about what others think, doesn't care about what others say, doesn't care about what they say. And also losing balance and problems with movement. Specific types of dementia can present with that. We all have some trouble as we get older, negotiating steps, going up them, going down them especially. But this is different. This is falling frequently, much more so than one would typically expect. And as patients get worse with dementia, they can become angry. They can become aggressive. There's a commercial that you might have seen on TV of a woman who, it's for a medication actually. I don't think I'll say the name because I don't want that to come off as like an advertisement or anything. But in the commercial, you see this once normally peaceful woman, older woman, getting angry. You don't hear her, but you can see her getting angry and slamming her fists. You can see that happen with dementia. A formerly peaceful person getting angry, becoming aggressive, even striking out, even using cuss words when that never was the case before. As things can get worse in dementia, seeing things and hearing voices can become a sign. The patient hears things, hears voices of things that aren't there, sees things that aren't there, old faces, other people, animals, little children. They may or may not have voices. They may or not be able to hear them. They might be able to see things and not hear them. They may be able to hear things but not see anything. They might also have beliefs that certain things are happening that aren't happening. I had one patient who believed that the accounting books for his business were all out of whack. And he needed to look into it, and he needed to look into it constantly. This was something he was worried about 100 times a day, when in actuality, someone else was managing his business. He wasn't even managing the business. He wasn't even looking at the accounts. That's another possible sign. And I've lost my, here we are. As things get worse, the functionality gets worse. The loss of function gets worse. Where it took 30 minutes to bathe, 2 hours to bathe, now they can't bathe. Now they can't dress. They can't do the everyday tasks that they used to do. You can lose bowel and bladder control. And of course, depression and anxiety. You can see that as well. And that can even begin at the outset of dementia. If you start to notice you're having trouble with function, with doing the things that you used to be able to do, that can lead to depression. Of course, it's going to make you sad, but it can be much worse than just sadness. It can make you depressed. There is some controversy about whether depression itself in our younger years predisposes to dementia in our later years. It's controversial. There's a lot of evidence for and against it. We don't really know right now. But with bipolar depression, major depression, there are some studies out there that indicate that they may be predisposing factors to dementia. There's even something called pseudodementia. And pseudodementia, which isn't a term we use that much anymore, refers to being so severely depressed that the patient appears to have dementia, and yet they don't have dementia. What they have is severe depression. And once that depression is treated, the signs of dementia resolve. Now I'm going to go into the more specific signs of dementia. And what I mean by the specific signs is there are different disease processes, again, that lead to the constellation of symptoms of dementia. Different pathways that lead to dementia lead to different patterns of symptoms. For example, in the case of Alzheimer's disease, which is the most common form of dementia, brain cells slowly die over time. So what we see is a progressive impairment over time in terms of memory. In the case of vascular dementia involves strokes and mini strokes and small vessel ischemic changes. But what happens is with each stroke, the signs and symptoms of dementia get much worse in a stepwise fashion, even over the course of a single day. If the patient is able to function at a certain level, that day they have a stroke, the following day there's a huge decline in their function. So what you see in vascular dementia is a precipitous, stepwise decline in functioning. Risk factors for vascular dementia would involve high blood pressure, high cholesterol. In Parkinson's disease dementia, Parkinson's is a brain disorder that affects movements. So what a lot of times you see with Parkinson's disease dementia is movement issues first, tremor, shuffling gait, problems being able to show expressions on your face. Those show up first before the general symptoms show up. With Lewy body dementia, you see hallucinations specifically, meaning you see things that aren't there, hear voices or hear things that aren't there. And it's not just voices. It could be music. It could be static on a radio. The point is, it's not there. It's something that the patient is experiencing. Progressive supranuclear palsy syndrome is another form of dementia, and that involves losing the ability, I should say, to look down. And so what happens is you see significantly more issues with falls, with going downstairs, and also, interestingly enough, a rigid torso. And I just wanted to mention this also, other causes of dementia. Dementia pugilistica, that's the dementia that boxers experience. It's from frequent head injuries, not just from boxing though, right? Boxers experience it, most famous example, Muhammad Ali. But frequent head injuries can lead to dementia, and you would see the general symptoms of dementia. Now, what should we do? What should we do if we're experiencing some of these symptoms or a loved one is experiencing these symptoms? You would see a provider. You want to see your primary care, a neurologist. You could see a psychiatrist, like me. What we will do is take a thorough history, including a family history. Genetics plays a part. It's in rare cases, but it still plays a part. So we would want to know the family history. But we're going to take a very thorough history, not just a family history. We're going to take a history of your medical conditions, predisposing, for example, medical conditions. We're going to run lab tests. We're going to run thyroid studies, a B12 level, a folate level, an RPR to rule out syphilis, which can be an occult cause of dementia symptoms, and it's also a reversible cause, by the way, meaning if you treat the syphilis, those dementia symptoms resolve to a significant degree. What else can we do? We can get a brain scan, an MRI, a CT, that would show us structural changes in the brain, possible evidence of strokes that might have been missed. We'll test cognition. What I do in my practice is I do a MoCA. It's called a MoCA. It's a Montreal Cognitive Assessment. It's not a coffee. Patients, their eyes light up when I say we'll get a MoCA. But that's not what it is, unfortunately. It's a 20-minute test of cognition. It takes about 20 minutes, but it gives us a very good sign of whether there's cognitive issues. And what I do after I find out the score, you score it, and if the score is low, then I send the patient for a neuropsychological testing, which is it's a battery of several hours of testing that pretty conclusively diagnoses dementia. Genetic testing. I kind of already mentioned this, but I just wanted to talk about it a little bit. It's rarely done, but it can be done. It's it's always done for testing for a single gene abnormality that can certainly lead to dementia. So in a patient who has dementia, you would get that test. You could get that test to test for that particular gene abnormality. In family members of that particular patient who has dementia, they could elect to get that test to see if they're at risk. It's very important, if that's done, that the patients get excellent counseling, which is why whenever genetic tests are done, lots of genetic counseling is also done. So patients understand what exactly it means when they get a positive or a negative genetic test. If you get a negative test, that doesn't necessarily mean you won't get dementia, right? I've already talked about how several different paths can lead to it. So we've eliminated one path, but there are still several others, so you got to keep taking care of yourselves. Genetic testing should be done by trained specialists in specialized labs, not saliva tests that you can get at home, not direct-to-consumer tests. I think there's, 23andMe? There's a lot of genetic tests out there these days. They use saliva samples. That's not the kind of genetic testing that we're talking about here. And I can't tell has anyone been raising their hand so far? Because I totally missed it if you did. All right, very good. Prevention. Wouldn't you like to know the things you can do to prevent or at least reduce the risk of developing dementia? Well, there are some things that we can do. We can take care of ourselves. Specifically, there's 3 types of preventive strategies that I'd like to talk about today, and that's targeting the body to protect the brain. All that's saying is taking care of your body, taking care of the medical conditions that you have to reduce the chances of developing dementia. Interventions to counteract brain aging, and these are things that you can do to help reduce the chances of your brain aging and reducing the chances of developing dementia. And then some lifestyle changes. So let's start with targeting the body to protect the brain. We know that there's a close interplay between the body and the mind in the development of dementia. Cardiovascular diseases and dementia tend to aggregate in the same person. Cardiovascular diseases and dementia also share common risk factors: obesity, smoking, high cholesterol. Atrial fibrillation, ischemic heart disease, and heart failure may contribute to developing dementia as well. So controlling those medical conditions, meaning seeing your doctor, seeing your primary care as often as you're supposed to, once a year, twice a year, taking your medications, staying fit, staying active, basically reduces the chances of your medical condition getting worse, which can reduce the chances of developing the dementia. And the same goes for stroke, hypertension, obesity, high cholesterol, diabetes. Control your sugars, take your diabetes medications, take your statin, watch your weight. I can't talk exactly, but watch your weight. Take your blood pressure medication, etc. Interventions to counteract brain aging. Lifelong engagement in activities enhance the brain's compensatory mechanisms. So higher levels of education have been found to possibly delay the onset of dementia. Anyone familiar with a Donovan Scholarship here in Kentucky? Raise your hand if you're familiar. Any others? At 65 years, thank you for raising your hands. At 65 years of age and older in Kentucky, you are entitled to free education at any public school in Kentucky, public universities. So
25 years.
25 years?
I went to school after I hit 65.
25 years.
Did me in, and so I haven't been going since.
Wow, wow. But you took advantage of it.
Yes,
Well, it's there. If you all are interested, go to HCEC, take classes, UK, U of L, any public Kentucky school. It's kind of interesting. Having a rich social network throughout life, but especially later in life, can reduce the chances of brain aging. Keeping yourself engaged, in other words, with family, friends, loved ones. Avoiding a stressful or a passive workplace. Stressful is too much. That's not going to help. Passive is also too much. It's too little, rather. You've got to engage yourself, so you've got to find that happy medium. So staying active in the workplace when you've retired, staying active even after you've retired, will keep your brain stimulated. And finally, lifespan health promotion. A healthy lifestyle should be achieved over the whole lifespan. So again, don't be sedentary. If you can avoid it, try to work out. Aerobics is best, but resistance training is absolutely fine. Avoid tobacco, avoid heavy alcohol use. What we have found is that light alcohol use is okay. Light to even moderate is okay, but avoid smoking. Watch your diet. Regular intake of fish, fruits, and veggies is acceptable. As I said before, moderate alcohol, but also moderate caffeine. So it's okay to drink that cup of coffee or mocha. And there are some diets that I listed here as well. But really, whole grain, whole food type diets, fruits, vegetables. Those have been found to be very helpful and key in maintaining longevity and reducing your risks for like developing cardiovascular conditions. And these are just some examples. If you have any questions about them, let me know. I'll try to get you information about them. The DASH diet, the MIND diet. Treatment, I'm going to go over this very, very quickly. There are medications out there, if someone has been diagnosed with dementia, that can slow the progression of the disease. And of course, remaining engaged, being active, occupational therapy can also be helpful. Caregiver support all can absolutely be helpful too when it comes to managing dementia. And that is the presentation. These are my references, and I'm going to open the door for questions. We have 3 minutes. It worked, huh? Yes, ma'am.
What is the difference between Alzheimer's and dementia?
Alzheimer's is a form, the most common form of dementia. So it is dementia. Now, it's kind of like saying, tell me if this makes sense to you. An elephant is a mammal, but a mammal isn't an elephant. The mammal is the more general term. That's dementia. Alzheimer's fits in that big category. Other questions? Yes, please rise, or just speak loudly, whatever you like. No, nope, it's useless. I can't hear you. I'm sorry. If it's high, you need to call or check in with your primary care. They can put you on medication so that is controlled and it gets to a normal reference point. Prevagen, I think there's one study out there on it, and it's not a very good study at all. So as far as I'm concerned, I go by the evidence. I treat and manage patients according to the evidence, and there is no evidence for it. So don't do it. Don't use it. Other questions?
Sir.
Yes.
I didn't get to write down, I'm trying to write down the risk factors for dementia, the types. One is reversible, which is B12 deficiency, and what was the other?
Folate.
Folate,
Yes, ma'am. Folate.
that's reversible?
Yes, ma'am. It is. Getting a TSH level. And also an RPR, which is for occult syphilis. RPR, exactly as it sounds.
How about irreversible? Did you have that?
You mean risk factors?
Yeah.
Progressive age. And then, of course, it depends on the type. So with vascular dementia, uncontrolled diabetes, which can lead to high cholesterol itself, obesity, and very multiple risk factors when it comes to.
Thank you.
Yes, ma'am.
Your TSH level, is it, if it's too low, that's dangerous, or too high?
Both. It should be normal. Very good question. Yes.
I'm on no medication. I couldn't hear her real well. Is there a medication that can slow the process down?
Yes, there's a few, donepezil, memantine, and then there's some newer medications that have come out recently that you might have even heard of. They were recently FDA approved, and they also have been shown to slow the progression. Yes. I think we might have to.
I was just asking if you would repeat the question when somebody asks
Oh,
a question,
you got it. Yes.
so that they know what you're answering.
Okay, so one of them asked about risk factors for developing dementia. Did you hear my answer? Getting things like a B12 level, a folate level, a TSH level, RPR level, watching your weight. Obesity is a risk factor for like vascular dementia, high cholesterol. She asked about if there are medications to slow the progression, and the answer is yes, there are, and there are some newer treatments that have come out recently that were recently FDA approved, and I can remember those two. She asked if the TSH needs to be low or high, and I said it doesn't matter. It could be both. It needs to be normal. Yes, it's thyroid stimulating hormone level. Yes. Yes, please.
I've just recently, within the last year, heard of Lewy body disease. Is that something new or
Lewy body dementia?
body dementia?
Yeah, so her question is about Lewy body dementia, which I did mention in the presentation. It's not new. We've known about it for a while, but it's characterized by Lewy bodies in the brain. And one of its characteristic hallmark features is hallucinations. Oftentimes non-distressing hallucinations, like little children running around that don't bother the patient, but they're still there.
I've heard there's a fast and a slow
Of Lewy body dementia?
body dementia.
I can't speak to that. I know a lot of them can be fast or slow. I would have to get back to you on that one.
We have a question back there.
Question back in the back?
Does aspartame in diet drinks cause dementia?
That is a good question. I think it's... Oh, I'm sorry. The question is aspartame a risk factor for developing dementia? I don't believe one can rightly conclude that just yet from the evidence. But I think there might be some possible evidence, meaning the jury is still out, but there's a suggestion that it could be something to watch. Again? Oh, thank you. Yeah, no glasses. It looked like you were raising your hand. You could have been using any finger, and I wouldn't have. I would have been like, yes, sir. I got it. One more question. Yes, please. Excellent question. It all depends on the type of dementia. Okay, so the question was, if I have a parent who has dementia, what are the risk factors for me? How much at risk am I in? And that's a very good question. It all depends on what type of dementia they have. If it was Alzheimer's, there are some genetically predisposing factors. If there's a significant family history, you could be at a higher risk than the normal population. You'd want to talk to your primary care about it and find out more. They would want to get more evidence about you, about your family, about one's family member, to answer that very good question. All right, thank you all very much.